Turn up your radio wherever you at. We about to bring it.
Street Beat.
Yeah.
With Tony B.
For the next hour, Tony B will give you a chance to tackle local, national, and international issues that affect your community.
Street Beat. Street Beat. Tony.
Welcome to this week's edition of Street Beat. Street Beat is your community affairs program that keeps you in touch with the beat of the city. It's me, your host, Tony B. And on this edition of Street Beat, once again, we're going to be talking about the coronavirus. Joining me will be Dr. Paula Houston, the Director of Healthcare Equity for the University of Washington Medicine. And I'm going to figure out exactly what that looks like. Dr. Houston, are you with us on the phone? Or via Zoom, actually?
I'm here via Zoom. I can see you.
All right. Well, thank you for joining us. Let's go ahead and get started off by what exactly does that mean? Maybe you can share with us the work that you do and what that means to be the healthcare equity person at the University of Washington.
Well, yes, thank you very much for having me, Tony. It's really a pleasure to be on here to be able to talk about not only our work in general around healthcare equity at UW Medicine, but specifically to talk about it for your listeners in South Seattle. I happen to be a Rainier Beach resident myself, so this is my community. So really, really pleased to be able to be with you. Yes, I'm the Director of Healthcare Equity for UW Medicine. UW Medicine is the healthcare system of the University of Washington. That includes our hospitals, which are UW Medical Center, 2 campuses, one at Montlake, one in Northwest, which used to be Northwest Hospital. We have Valley Medical Center and Harborview Medical Center. We also include our UW neighborhood clinics and Airlift Northwest, as well as the School of Medicine. So we are a huge organization, almost 30,000 people work among the organization. And I lead a team that includes a medical director, Dr. Patricia Dawson, and our program operations specialist, Keith Fency. We lead the work on ensuring that through the work of our healthcare equity blueprint, which is our guide, that we become leaders in healthcare equity and help decrease health disparities in our communities. We have 3 objectives in that work. The first one is around our workforce, so ensuring that our workforce understands what institutional racism is, how it perpetuates some of the history of race in medicine throughout our healthcare system, that they understand concepts like implicit bias and microaggressions and intersectionality and inclusion, the importance of diversity and inclusion. So in that realm, we do a lot of training and consulting and presentations. We've helped to convene diversity, inclusion, and equity committees across the system. The second area is around our community engagement, and that's really reaching out to our communities and asking them to be our partners in helping to identify health inequities and health disparities, and really listening to them as they tell us how we can do better by them. And then the last piece is around our clinical improvement, so really using our data and looking at where we see the health disparities, what groups we're seeing those in, and then doing things differently to help to mitigate those health disparities.
And in addition to all of that, slightly unrelated, but I just thought it was impressive, you're also a champion power lifter?
I am, yes. So, yes, I've been powerlifting for over 20 years and have had some really great success. I've had won 12 national championships and 6 world championships in that realm.
All right. I just
so
had
it's
to give
actually
this...
very tough on me, of course, that we have gyms that are closed now. So I'm trying to get creative in my basement with weights that I'm not used to using. So
that was a special South End resident shout out for you. Again, you're listening to Street Beat. It's me, Tony B. My guest is Paula Houston from the University of Washington. So we were one of the things that I wanted to know was, with all that you've said, how did the coronavirus impact what you do and how you do it? Or did it at all make anything different about the way you do things?
Yes, it actually did make quite a difference. As I said, a lot of our work is doing presentations and trainings for our workforce to build awareness, to help them understand the history of racialized medicine and institutional racism. So a lot of our work involved us being in front of large groups of people doing presentations. So as soon as the no large gathering directives came down, that actually changed our work substantially, but it shifted us to really focusing on the clinical improvement pieces and where those disparities are, and the community engagement pieces. Thus, our work to focus on marginalized communities, those communities that we know are underserved in the best of circumstances. So our Black communities, communities of color, limited English proficient communities, our immigrant communities, and trying to ensure that testing was accessible and available to those communities. So that's really been the focus of a lot of our work now, as well as getting transportation in place for folks who have tested positive but can't get to a clinic, or are just or have symptoms and need to get to a testing site, or have a need to get back from the hospital after they've recovered. Also working with our colleagues that are working with the homeless populations, and making sure that those patients who have tested positive in a homeless shelter have a way to get to an isolation shelter. So a lot of my team's work has also been around working with our transportation providers in the community and public health to set that up. And we've had really great success in doing that. So now we have some transportation in place for folks.
Well, it's good to know that that exists. When did you really start ramping up in that area? When we heard about the first case, which was in Kirkland, some of the things that initially came out were that it was older, that you were white, and in some instances in the Black community early on, there was a thought that for some reason Black people could not get this thing. And it wasn't until a few weeks later that we finally started getting some national statistics that showed the incredible disparities about how the coronavirus was impacting. And it was like some things that we felt like we knew were going on in our community as a broadcast entity. We had talked to some folks in our community and knew that it was here, but it didn't seem like it really hit the national radar for at least 3, maybe even 4 weeks. For the University of Washington, in this position you held, when did you start ramping up, and how early did you realize that you needed to prepare staff to deal with the disparities that were going to take place that could eventually be along racial lines, or at the very least along poverty lines?
Sure. So it really took. It was probably a couple of weeks in. I think at the minimum, maybe even the first weekend. I want to say around mid to late March, when there was a group of people at Harborview Medical Center who noticed that that there was some disparity and disproportionality in our limited English proficient patients, both in testing and hospitalizations, and so. The group of us that do this work and start to look at data said, we ought to start looking at all of the demographic data, what we call our race, ethnicity, and language data, or real data, and started tracking that. And so at the end of March, rather, we had a report pulled that included the real data, race, ethnicity, and language, and then also housing security, which are obviously a measure of poverty. And so we started, we started seeing some small disparities and disproportionalities, but realized that it was something we needed to monitor and track. And so we started doing that. And then as the weeks went on, we saw, again, not huge disparities as we're seeing in some of our other cities across the nation, but still something that was of concern. And so we realized that was something that we wanted to follow and actually have a focus on, and just started talking about it, continuing to show the data, rising it up to the level of our clinical leadership. And they were very responsive to where now there are a group of us that are leading the work formally in our leadership around vulnerable populations. And so that is both the communities that I mentioned earlier and our homeless populations, and also some of our senior populations. So just those populations that we've heard, if you know anyone who was watching the national news knows that they are the ones that have been most susceptible to the devastating effects of this coronavirus.
So what does that look like when you take it from theory or you take it from explanation and say these are things that we now see? How does that, when the rubber hits the road, what difference does that make, or what changes does that look like when folks become aware of this?
Well, for us, it really meant that we wanted to get testing out into these communities. And we reached out to our partners at Public Health to ask, where in their siting were they seeing testing sites that were in these communities of concern, because these are communities that in the best of times see disparities in them. This is not data that's new to this world of coronavirus, but we know where the disparities are in our city and our county. We have a fantastic public health department that puts out regular reports around this, and so we know that those are the areas of concern. And so we assumed they were going to be the areas of concern around coronavirus as well, and indeed the data ends up showing that. So seeing that there were no testing sites based on the mapping that they had done, we said, well, you know what, we need to have a way to get some testing down in there. So while we were looking at that, at the data and where to put the testing sites, there was another group, Paul Hayes, and who is the CEO of Harborview, and some of his clinical leadership were working on securing a grant from the Paul Allen Foundation around vulnerable populations. And for them, that was mainly to be focused on the homeless population. And so they were able to get that grant. We were then able to appeal for some of the dollars in that grant to be used in other vulnerable populations, a subset of which is definitely homeless and housing insecure. And so that's how we were able to get what is now the first public site down in South Seattle. So, for us, it was, okay, we have the data. We know where the problems usually are, where they are now.
Mm-hmm.
Let's do something about it. And I must say, I've had this job 2.5 years. I've been part of this system and have been a part of other large bureaucratic systems, but I've been really, really impressed and honored to work for a system that was able to take the data, know what the problem is, put something in place, and get something in place to address it really, really quickly.
Well, you know what? I'm gonna kind of paraphrase this, and you correct me if I'm wrong, because I think that's important information. So essentially, you say disparities are going to take a place. Let's put some research into it to find out. You do that. You find out that they are, and then you apply for a grant so that you can specifically address the issue. It's got to be some kind of rapid response grant to get it back so quickly. And then you say, okay, where are the communities that are going to be impacted that we need to make sure that we get testing to specifically address the potential disparities and how it's impacting communities. And that's kind of how we ended up with the testing center in Rainier Beach.
That is pretty close. There was a group working with the Paul Allen Foundation. I think we have great advancement fundraiser people who work with the large foundations all the time, and they knew that the Paul Allen Foundation had some interest in vulnerable populations, and so they got put together the people that were interested here, the people that were interested there, and it became a match. And so they were able to put their significant funding into something that they were passionate about and wanted to make a difference in. And we had the need, and it was just one of those times where it came together in the right way for the right reasons at the right time.
You're listening to Street Beat. It's me, your host, Tony B. My guest is Dr. Paula Houston, Director of Healthcare Equity for the University of Washington Medicine. And I want to talk about the testing site, but we've been hearing about this thing called the UW model, which is kind of impressive when you watch national television and think, oh, whatever it is that's going on here, they're using our university. Can you tell us a little bit about what the University of Washington model is that at least is getting cited by a number of different news agencies across the country?
Yeah, I think you're talking about the modeling that we've seen on the national news by our unit called the Institute of Health Metrics.
Right.
That's been an institute that's what they do is modeling of all sorts of health issues, not only here locally but across the world. And they've been world renowned for doing their modeling. And so, when this came up, they were a natural one more expert that we have here at the University of Washington in the state of Washington that was seen as a trusted resource. And that's why we're seeing that out there.
Okay. Let's talk specifically again about the testing site at Rainier Beach. As you, I'm sure, are aware of, when it comes to medicine and vaccines and injections, the Black community in particular has reason to be skeptical of the medical community. And I have heard firsthand some of those questions about this particular site, what it's for, what it's there to do. This is a big question, but let's just start with this. Tell us what you can, big picture wise, about this site, what it's there for, what the results are going to be used for, what happens with the testing process, who can be tested, and what information you need to have in order to be tested. I know that's a lot, and so the way that I'm putting that is just give us the big picture about what's taking place at the boat launch dock at Rainier Beach, where there is now, I believe it is on Wednesdays and Saturdays, testing for the coronavirus taking place.
That is correct. So this testing site is there Wednesdays and Saturdays. And who can be tested is anyone that has the symptoms and does not have another place to be tested. We really wanted this very community-based and really focused on those populations that didn't have another place to go, weren't connected with a health system, for some reason didn't have access, if they did have a health system that they were connected with, and wanted someplace that was in their community from a trusted provider. So we, and again, the folks that we are focusing on are Black community, limited English proficient, other communities of color, our immigrant communities, which, as we know, is who lives in Rainier Beach area largely. So that's who we're testing. In terms of why we selected that particular site, again, looking at the mapping that the Public Health Department did. Someone used a term which I think is quite apropos, is that there was really a testing desert down in the south end of Seattle into South King County. And so we wanted to make sure that testing was available and accessible, which is why we have it both as a drive-up site and a walk-up site. So no appointment is needed. You drive up or walk up. There's a pre-screening to ask about what symptoms that the person has. Then they get in line, get tested. We are asking for demographic information. And the reason we are asking that is that, as we talked about earlier, we know that the burden of disease is much higher in our Black and Brown communities. And if we don't have that demographic information, and if we don't have it accurately, then we won't understand what the burden of disease is. And so we won't know how it's affecting us, and we won't know really if we are in fact mitigating the disease in those communities. So
Now,
the reason Yeah, go ahead.
For some folks in this community, and again, I'm not judging here or just basing this on politics, there may be reasons why they don't want to give you their information. Maybe perhaps they're, here in this country illegally. Maybe there are other underlying reasons why they are not wanting to have their information publicly known or known to an entity. But at the same time, as we know, if they're in the community and they're being exposed to the coronavirus, that doesn't change. For folks who are concerned about the impact that, hey, you know what, if I do this, somebody might call ICE on me or something like that. Can you just talk about the testing process, who's getting tested and where that information goes, and whether or not someone can be secure that if they feel like they need to get tested, regardless of the circumstances, there's a certain amount of privacy that will go along with that?
I can absolutely talk about that. So first of all, I want to make it clear that we don't ask about immigration status, and that this is essentially an outdoor medical clinic. So we are bound by all of the privacy laws that are around an outdoor medical clinic. You will notice that we have, if anybody has gone down there, we've had photographers and news down there, and we've asked them when we know that they are there that to not photograph our patients or anybody actually being tested or anything that can identify them. And if you've noticed the photographs that have been in the paper, they've been of the staff, they've been of the van, they've been of the site itself, and so I'm really pleased that our media has been very respectful of that. So we keep this information like we would keep any other medical information. It's not shared with anyone outside of our system.
And at the end of the day, I think it's important that our community knows what goes on. Will this information be shared with the community at the end of this, or will there be updates so that as you're gathering this information, the community also becomes aware of where we're at in this process of being negative or positive, or folks who may be, what is it called, asymptomatic or something like that? Or?
Sure, asymptomatic, but still have but may still have the virus if they've been tested. So what we do at UW Medicine is we share the aggregate information with public health because this is an infectious disease. We're in a pandemic. We have to report that. But we don't share individual testing site information. We don't share individuals' information. It's all shared in aggregate. You can go to the public health department, Seattle King County, or the Department of Health and see the aggregate information. And that's how they get that aggregate information, is from all of the healthcare institutions and clinics and sites that are doing testing. And that information is then aggregated by race, ethnicity, language, and some other areas, and will show the burden of disease. Again, I want to emphasize that we are asking for the demographic, particularly the race and ethnicity language, because the last Department of Health information, or King County Health information that came out at the beginning of this month, April 10th, they were only able to report about 50% of the people that had tested with their race and ethnicity language. So that means we're not gathering the information. So if we're not gathering it, we don't know. Mm-hmm. So we have to gather it so that we actually know who is being tested.
And how long will the site at the boat launch at Rainier Beach be there? Do we know for sure yet?
We're going to be there for the next several weeks, and then we are in planning to have a site, another mobile site that will also go to some of the other communities both around Seattle and in South King County that have sort of the same demographics that Rainier Beach has, and with known areas of health disparities where, again, those populations that I mentioned are prevalent.
Well, Dr. Houston, I want to thank you for joining us and sharing this valuable information about the impact specifically on South Seattle community, which is Rainier Avenue Radio's community radio station. I want to give you the opportunity for final words here in case there's something that you just specifically want to share with the community?
Sure. One of the things that I want to share with the community is that, again, this is my community. I want to do what's best for my community in my role as the Director of Healthcare Equity. And we are using this opportunity to really engage communities in a different way. One of the things that we didn't talk about earlier was the process that we went through. We have our city partners who have been great. The Department of Neighborhoods helped us gather a group of about 17 community organizations that are based in South Seattle to talk with us before we even launched the site, because we wanted the community to know that we were coming in. We wanted to hear from them what concerns were. We wanted to be able to answer questions and really start to build a relationship and build some trust in our system specifically, but in the healthcare system in general. So we expect that this is going to allow us to continue to engage communities in a more robust and in a deeper level than we had before. And we are very sincere when we say that we want to continue to have community be our partner, because we know we haven't been doing well by many of you, and we want to do better. And so we really want to take this opportunity to deepen these partnerships, and we'll be following up in the coming months and weeks, even after coronavirus, so that we can just be better at making sure that we can keep our communities healthy.
Thank you, Dr. Houston. That's it. That's about all the time that I have. Be great to have you come back in a few weeks and maybe just give us an update and let us know how things went, how things were going, what the response was.
Would love to do that.
Awesome. And I'd like to thank everyone for listening. We'll be back on Friday for our 1 to 3 o'clock coronavirus special that we're doing. Until then, it's me, Tony B., your host of Street Beat, saying, remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.
This is Paul Pearson, host of Star Time. And when I'm not stopping a Mercer Island street